Okay. Let's continue our discussion on the accumulation points or the C points. For today, let's discuss LI7, or it is also called warm flow, or the 1U. LI7 is located 5 tune proximal to the anatomical snuff box in the direction of the lateral end of the elbow crease, or 1 tune distal to the midpoint of the line connecting LI5 and LI11. So how do we find LI7? First, we have to note that with the hand supinated, the line connecting LI5 and LI11 runs alongside the radial margin of the forearm. However, with the arm pronated, it transverses the forearm. So LI7 lies on the dorsolateral aspect of the radius and is best located with the forearm in mid position and the elbow flexed. Using the spreading hands technique, we place the little fingers on LI5 to LI9 and span the hands evenly so that the thumb joins at the midpoint of the line. From there, measure 1 tune distally to the triple warmer 8 is located 4 tune proximal to the wrist crease between the radius and the ulna in the center of the dorsal forearm, or 1 tune distal to LI7. Okay. So with LI7, kneading is done vertically at 0.5 to 1 tune depth. For its indications, it is used to treat acute disorders, to clear heat and toxic heat, and to regulate the stomach and large intestine. As its special feature, it is the G-cleft point. LI7, like most accumulation points, stops pain and removes obstruction from the channel and is particularly useful in acute situations. It is widely used in painful obstruction syndrome of the channel and also heat conditions of the mouth and face. LI7 opens the mind's orifices and mental, emotional conditions occurring against a background of heat and the bright young. As mentioned before, whenever ancient books mention seeing ghosts or talking to ghosts, it usually means that the point is indicated in serious mental conditions such as psychosis. So, in summary, LI7 is, as an accumulation point, it is used for painful and acute conditions of the channel. It clears heat in the face, like swollen tonsils, facial furuncles, and others. It also opens the mind's orifices. LI7 is the G-cleft point of the large intestine channel. The G-cleft points are where the qi and blood, which flow relatively superficially along the channels from the jingle points, gather and plunge more deeply. The G-cleft points in general are indicated in the treatment of acute conditions and pain, and this is reflected in the ability of lung or LI7 to clear heat and detoxify poisons in cases of clove sores, carbuncles, and furuncles, throat, painful obstruction in heat and swelling of the face. Clove sores are small, hard, deep-rooted, clove-shaped, purulent lesions. They are primarily due to unregulated diet or external wind and fire poison, which invade the superficial portion of the body. The condition tends to develop very rapidly with severe localized pain, redness, and swelling, which is often accompanied by fever. One notable feature of the Han-Yang channels, which includes the large intestine, the Sanjiao, and the small intestines, is that relatively few of their points treat disorders of their corresponding fu. As far as the large intestine channel is concerned, large intestine 7 and its following points LI8 and LI9, however, are indicated for disorders of the intestines and stomach. In the case of LI7 for berberigmus accompanied by abdominal pain, abdominal distension, and vomiting of foam or watery saliva. This follows the general principle of all yang channels, most clearly seen on the leg yang, that as the points approach the elbow or knee, they begin to have a greater action on the corresponding fu. It should be noted, however, that in clinical practice, points of the large intestine channels are rarely used for disorders of the intestines. And this is born out of the absence of LI7 in combination for this purpose in any of the major classics. The action of LI7 on clearing Yangming fire and calming the spirit, and thus treating frequent laughter, raving, and seeing ghosts is similar to that of LI5. Thank you for listening.